My name is Dr. Glenn Charles, and I'm a cosmetic surgeon that performs primarily hair transplantation. Male pattern baldness is very prevalent. There's millions of Americans who suffer from male pattern hair loss, and most will notice some hair loss by the age of 35. Hair loss in men, it can affect men in a lot of different ways, but I think most commonly what would be affected would be some type of lowering of the self-confidence, the self-esteem, the way they talk to people, the way they perceive themselves. So I think that having hair is important to a lot of men. Well, there's two main options, which would be non-surgical and surgical. As far as the non-surgical options are concerned, there's some topical products that are used, and there are a few prescription medications that can be used also, but most of those are more leaning toward the preventative hair loss situation versus repairing or replacing hair loss. So the only way to really take an area that has hair loss and get more hair in that area would be to transplant the hair from the back to the front. The ARTAS robotic system is the only FDA-cleared physician-assisted robotic device that's used for hair transplantation. Well, I think one of the main advantages of the ARTAS would be that the patient would not have a linear scar on the back of their scalp, which is often, if noticed by other people, would be perceived as someone who had a hair transplantation procedure. And with the new technology available, especially with the ARTAS machine that we have now, we're able to do a hair transplant on a patient, not have the linear scar, which leaves that patient more options later in life as far as hairstyling and wearing shorter hairstyles. There's really nothing that even compares to how precise the ARTAS is. That is the main reason why I chose to use this device to do my procedures, because no human can make the calculations that this machine can make in that short period of time without having any type of fatigue factor throughout the surgery.